Good morning and welcome. It is a great pleasure to welcome all of you today. I would like to extend my sincere thanks to the journalists, university representatives, directors of postgraduate programs, colleagues, and prospective participants who have joined us for this special occasion. Today, we are proud to present this new educational initiative, a program designed to advance knowledge, clinical excellence, and professional development in the fields of periodontology and implant dentistry, and dentistry overall. This course represents far more than an academic offering. It reflects a shared vision for the future of oral health care, one that is grounded in scientific rigor, innovation, and commitment to improving patient outcomes. This initiative is the result of a strategic partnership between the Complutense University and the Spanish Society of Periodontology, SEPA. Both institutions share a long-standing commitment to excellence in education, research, and evidence-based clinical practice. By combining the academic strength and international reputation of Complutense University with the scientific leadership and professional expertise of SEPA, this collaboration creates a unique platform for advanced learning and professional growth. Together, our institutions seek to provide participants with the highest standards of training, fostering clinical thinking, scientific excellence, and practical skills required to address the challenges and opportunities of contemporary periodontal and implant therapy. It is also my privilege to introduce the two co-directors of this course, Professor Mariano Sanz and Professor Elena Figuero. Mariano Sanz is internationally recognized as one of the leading figures in periodontology and implant dentistry. His contributions to research, education, and clinical practice have had a profound impact on the profession worldwide. Through his leadership, scientific achievements, and commitment to advancing knowledge, he has helped shape modern periodontal and implant therapy. Alongside him, we have Elena Figuero, who brings an outstanding academic and scientific career distinguished by excellence in research, teaching, and clinical practice. Her work has earned international recognition, and her dedication to evidence-based dentistry and innovation continues to inspire professionals and students alike. Together, these two professors provide exceptional expertise, visionary leadership, and international prestige to this program, ensuring a learning experience of the highest quality. Thank you once again for being with us today. We look forward to sharing this exciting educational journey with all of you and building together a community committed to excellence, innovation, and better patient care. Thank you very much. Mariano Sanz, we are all yours.
Thank you, and welcome to this presentation and press conference. We are very proud to present this course on research methodology. And of course, one of the questions that you may ask, and we also, of course, ask ourselves, why research methodology? Why is that important for the professionals in dentistry? Why specifically on periodontology, implant dentistry, and regenerative therapies? Why now? What are the challenges now to make us launch this course? On the other hand, what are the opportunities for developing this program and launching it internationally? Let me, in a way, very briefly, try to address these issues. Why research methodology? Well, the main problem we have today is that most of the treatments that we teach in dental schools, both at undergraduate and postgraduate levels, become obsolete very soon because science and technology is driving that fast that unless we update ourselves, we lose the train, basically, of the current trends in how is the best way to treat our patients. And the problem we have is that it's not because of a lack of information, because we have lots of information from industry, from, of course, social media, and of course, from artificial intelligence. So whenever we want to ask a question, we will get an answer. The problem we have is that we become consumers of information unless we have the ability to digest that information and to elaborate the thought processes to come up with the best solutions and the best decisions driving that information. And this is why research methodology is so critical, because without methodology literacy, we cannot evaluate the evidence, the scientific value, and we cannot evaluate how technology is the driving force of the decisions that we do with our patients. So there is a real need, not only for those young dentists who want to be in academic or want to have a research career. Of course, for them, this is very important. But this is important for any professional who really wants to treat properly their patients and wants to be updated. And then the question is, why periodontology, implant dentistry, and oral tissue regeneration? Well, first, it's obvious, is because this is our main field of interest, and this is the field where we have developed our own personal research for the last 35 years. But beyond that, these are the disciplines in dentistry where science, innovation, and technology is driving faster, and therefore are the areas of dentistry where understanding the scientific facts, understanding what is the outcome of the research, which is what we read in scientific papers, understanding these papers in what they mean and what they imply for the treatment that we render to our patients becomes critical. So these are basically the main reasons why we have selected to do this course. I think we live in a world today of a big challenge, is that we do research to answer questions, to solve hypotheses. And the problem will be when we don't have questions to ask, because we have somewhere an IA, artificial intelligence system, that provides us with all the answers. And the only way that we can overcome that problem, and we can use effectively the artificial intelligence tools that provide us with a new horizon on the daily activities that we do today, is if we have a critical mind, and if we are able to be inquisitive, to ask questions, and to understand the methods to solve these questions. And this is basically the knowledge, the qualification, and the skills that we would like our participants to acquire. Our goal is not so much to develop researchers, not at all. Our goal is to allow professionals to understand science and to understand how science is produced and science is presented. And not only science, also technology, because the problem is that we are overrun by the technological advances, and many times our only communication with these technological advances are the industry and industry people that want to sell us their technology. So we need to have a critical mind and also the skills and the tools to understand what it means and to take good decisions on how to best apply those technological advances. So in essence, we are not at all against technology or against artificial intelligence or against communication in general. What we want is to allow professionals in dentistry, and particularly those interested in periodontology, implant dentistry, and oral tissue regeneration, to have the ability to excel in their practice by allowing themselves to use the best evidence, the best technology, and why not to allow themselves to get inserted in the development of knowledge by doing research themselves. So the people that can access to this course are very varied, from professionals to people who are undertaking doctoral or master studies, postdoctoral, postgraduate students in general, those young professionals who want to have an academic career, and of course, any professional who want to use the best scientific facts and also the ability to produce science by themselves. So let me introduce to you Elena Figuero, who will briefly present to you the objectives, the structure of the program, and what is the main content of this program we are launching today.
Well, thank you very much to all of you for being here in this media press conference in order to really show you what are the most important aspects relative to this new course on research methodology in periodontology, implant dentistry, and oral tissue regeneration. Although we are talking about the introduction of new course, I want to highlight that this is not so new. So this is in 2027, we will launch this course in the international audience, but we have been working since 2012, so from 2012 with research methodology in dentistry at a national level, let's say in Spain. So 14 years ago, we decided to set up a course because we identified that there were some gaps in the research methodology knowledge that our attendees have. And along with Professor Mariano Sanz and Professor Luis Aracil, Professor Juan Blanco, and Professor Pepe Sanz, we decided to just set up a new course dealing with this specific aspect. So for 2 years, we were trying to set up the basis for what we are launching today. And it was in 2014, that CEPA decided to adopt this course. So we entered in the postgraduate program from courses from CEPA with Professor David Herrera as the president. And since then, we have really been doing one edition 1 year after the other. Let's say we have just finished the 14th edition this year. In fact, we are going to finish it this next weekend. And we have trained since that time for these 14 years, we have been training more than 300 participants, 300 people which now has their own abilities, their own skills to really not only understand research, but also generate their own research. So what we are doing now is we are launching this new course at an international level. So this has 40 credits, 40 ECTS in the European level, and it has a blended methodology. That means that it's flexible. That means that it can be adapted to your specific schedule, because we are going to combine online and on-site modules, just trying to provide a comprehensive learning experience to any of you who want to join. So how it's organized? So as I've told you, it is organized in modules. So it has 4 modules, 2 online and 2 on-site. So we will start in January 2027, specifically on the 11th of January 2027 in the Faculty of Dentistry of University Complutense of Madrid here in Spain with the on-site module. So this on-site module will last for 5 days. So from the morning till the evening, we will be together doing specific lectures and specific statistical tools, specific softwares. We really need to set up the basic for all basic tools that are needed in order to properly understand not only statistics, but also research methodology. So from Monday to Friday, we will deal with descriptive statistics, with basic statistical analysis, with regression models, or with correlation. Each lecture will be followed by hands-on practice. So each student will develop everything just with their own computers. So after that, we will start 2 big modules that will be online. So from January to June, everything will be done online. So the second module will be dealing with advanced tools in research methodology and biostatistics in dentistry. So as you can see, these first 2 modules are cross-sectional for dentistry, because more or less the research methodology and the statistics are the same, independent of the disciplines within dentistry that we are dealing with. In that advanced module on statistic and research methodology, we will focus on data registry, on sample size calculation, calibration, how to perform the statistics in longitudinal studies with repeated measurements, or which are the specific analysis that should be done in randomized clinical trial, observational studies, or systematic reviews. Everything will be online. That means that you will be able to just view these webinars whenever you're available for, but that will be combined with some specific synchronic sessions in which one you will be able to debate with the coordinator of that specific block, or you will be able to really raise your concerns and questions, because that is important to be said. During these 6 months, each students will need to develop a specific protocol that will be defended in the last module. So you will be working not just specifically with seeing webinars, but also you will be developing your own research. So after this second module online, we will move to the third module, which will be also online, but that will be specific on research methodology, on periodontology, implant dentistry, and oral tissue regeneration. During this third module, from April to June, we will review any specific outcome, any specific study design, specifically dealing with periodontal diseases, with peri-implant diseases, with an implant dentistry, with oral tissue regeneration, and how to apply these not only in clinical studies, but also on preclinical studies, either in vitro, let's say in the lab, or in vivo, let's say with animal models. So everything will be reviewed, as I said, once again, as I said already, in an online mode. And we will finalize with the module 4, and that one will be once again here in Madrid in our Faculty of Dentistry. That means that it will be on site. So from Monday to Friday, we will follow a specific workshops. So you will have experience on-site experience on how to calibrate, how to write a publication, how to perform an oral communication, how to create a specific graphic or specific table for your analysis. And of course, we will have our final defense of the protocol that you will have been preparing for the previous 6 months. During these 6 months, you will not be alone preparing these protocols, because each student will have a tutor, and he will be able to have specific sessions with her or with him, trying to really help in an individual mode how to perform this. So as has been already mentioned by Paula and by Mariano, this has been done thanks to the agreement between two important institutions, SEPA, Spanish Society of Periodontology, and UCM, University Complutense of Madrid. So we are proud to present you to join forces in order to really reach any of you. And just to finalize my part, just remember that it is not exclusive for young faculty, the ones who want to perform this course, but also people performing their doctoral master programs, people who are already clinicians that really want to learn better how to interpret the evidence. You are all more than welcome. So everything will be explained from the basic aspect to the more advanced one. So we really are proud to set up this experience with all of you. So Paula, I think, and Mariano, I think I've tried to summarize everything here. So glad to answer any potential question or comment regarding it.
Yes, thank you. Thank you so much. Indeed, we have some questions that I'm going to read for you so that you can be able to answer them. The first one goes to Mariano and says that evidence-based dentistry is now a widely accepted concept, but not always was applied. What are the most frequent errors you observe when clinicians interpret or translate scientific literature into daily practice?
Well, the most common problem is to have the ability to grade the evidence, because we have so much scientific information that is not the same quality, the evidence that comes from a report of, let's say, 10 treated cases by a professional who published the performance of their therapeutic technique that he or she is using, to a randomized clinical trial of 150 patients where a treatment is compared to a control. So ranking the type of studies, grading the evidence is one of the concepts that we are going to drive very specifically in the course. So the issue is not to be able to apply information from published papers to the clinic. The issue is how to apply the best evidence information. And for that, you need the tools and you need the knowledge that we are going to try to deliver in this course.
Thank you. And this one is for Elena. You have pointed out that many clinicians have good ideas and access to patients, but lack a structured methodology for research. What is the main obstacle preventing these clinical questions from becoming high-quality publishable studies?
Okay. Thank you very much for this interesting question. The problem is sometimes we do not know how to do it. Let's say we have the idea, but we have not been properly trained in research methodology. So let's say that research methodology, it's like the recipe that you need to follow in order to try to answer a specific questions. So we might have the question, but then we need to know the rules in order to properly answer these questions. So these rules are the research methodology. So what we need to know is to know the rules. So what we are trying to organize here during this course is to standardize everything. So from the way you need to formulate properly the question, then how to translate this question into an objective, and how, based on this objective, based on the evidence that it's already produced out there, and based on the specific conditions that you have, try to design the better study. Try to create the best protocol in order to really provide an answer to that question. And it's not only important to develop a good protocol, then we need to follow it during all the study, and finally we need to publish it. Because if we perform on a study, but then we do not release the information, then nobody will know our results. So it's not only important to be trained on how to perform a protocol and how to develop the protocol, but also in how to distribute its information, so how to really write a publication. And that is why we have really created a specific workshop, one on study design and the other one on how to write a paper, because it's the best way to really disseminate what you have obtained. So summarizing it, you need to be trained. You can have good idea, but this idea needs to be modulated and articulated in order to have a good final result.
And this question relates or links a little bit with the coming one from Gemma Bonacci that says, what skills do you think are essential to design and carry out a high quality clinical research? More or less it's answered by...
it's exactly more or less the same. We really need to have
follow the rules.
To follow the rules, and in order to follow them, you need to know them in advance. So sometimes we're experiencing some people starting their first research. They just came to us with a lot of data that they have retrieved, and then this data cannot be used or cannot be published because they have not followed properly the rules 2 years ago, and that it's a pity because you're losing time. So the idea is trying to spend 1 year, it's not only 1 year, 6 months, in order to save further time, in order to save further energy, in order to create really high quality publications.
Also, I think this is what probably adds this course, because we have also the applied component. And the applied component is not only to understand the rules of how to design a study, but also how to specifically apply technology for the different studies that we are going to do. For example, if we are working with dental implants, very important how to measure, for example, CBCT scans, how we can get the DICOM images, how we can process those DICOM images, how we can measure the differences. This is going to be taught in the specific part, because this specificity will apply to the different research types that we can do in periodontology, for example, periodontal regeneration, for example, in mucogingival studies, for example, in bone regenerative studies. All these have specific technologies that we apply to measure the different outcomes that we use to evaluate or to basically answer the questions that we frame when we design the study. But it is important to master the methodological design as it is to master the technologies that we need to evaluate the outcomes.
Yeah, and if I may add something, Paula, just related to that. Once you know how to acquire the data, it's also really important how to transfer this data into proper data registers or into proper ways of analyzing the data. And this is also something that you're going to see. We're going to explain the attendees not only the methods to extract this information from the techniques, from the technology, but also how these need to be prepared in order to be properly analyzed from a statistical point of view. Because if not, we will have a disbalanced. So data need to be properly registered and then need to be properly organized. And then we also explain them how to analyze their own data and how to interpret them. Because one can go to a statistician and the statistician can perform the statistics, but then we need to interpret it. And so we will focus on the analysis, that it's important, but what it is more important for us is to allow the students to have the enough knowledge, the enough skills to really be able to properly interpret the data coming from a statistical analysis. And we are all aware that it is not so easy when you have 100-word document with a lot of tables, not of numbers. So we will teach them which data are the important one and how these should be transferred into the publications.
Mm-hmm. Do you think, has there been a significant increase in interest in research in periodontics and implantology documented in recent years?
Indeed, because this is something that can be measured. So we have data on the number of scientific publications in these three fields, or we can summarize periodontology and implant dentistry. Actually, the highest ranked scientific journals in dentistry, I would say 80% of the top 10 are within periodontology and implant dentistry. And if you look at the number of papers published in the last 5 years, you can see that basically doubles the number of papers published in the previous 5 years. So indeed, there is a huge amount of scientific information, not always of the best quality. And this is why we estimate that learning how to evaluate the quality of science is absolutely critical today, because you can understand that information not only comes from scientific papers, information comes from many sources. There is a lot of information that young people today are acquiring from social media. And of course, there is a lot of information that we get from some of the IA programs. So it's more important than ever to really understand how to digest that information in the best possible way, because as you understand, we are talking about diagnosing and treating our patients. So we have a big responsibility to do the best possible care for our patients. And in this sense, to have a good training on how to apply the best information is critical.
Yeah, and if I may add something on this, we are in the area of evidence-based dentistry. We cannot treat our patients, we cannot diagnose them without having good and sound scientific base. And the scientific base does not come from what we were taught when we were dental students. It comes from the everyday literature that it's been generated. So it's really important to be properly trained in order to, as Mariano was saying, to really understand that. So just a couple of weeks ago, I have been preparing a lecture on these publication numbers. So I can give you some data that might be interesting. So in the field of periodontology and implant dentistry, more or less 130,000 publications in scientific journals, according to PubMed, has been published. Since we started this course in 2012, more or less 60% of the evidence was generated. That means that the increase in the number of publications is not linear, it's getting exponential. So just in 2025, around 90,000 articles published in scientific journals has been released. And just from COVID, let's say from 2020, right after the COVID pandemic, more or less 1/3 of the scientific production in periodontology and implant dentistry has been published. So that's really means that there is a need to be properly trained. So that really justified the demand for this joint course from CEPA and from University Complutense of Madrid. That is really, we're talking about really a lot of publications. We are in the area of infoxication. We do not have the time to read all these articles. So at least we need to read the ones with the highest quality. I know that to do so, we really need to know which has the highest quality and which are not so good. So just remember, at least or more or less 1/3 of the scientific production in the area or in the field of periodontology and implant dentistry has been published since 2020. So 2027 will be the 15th year, the 15th edition of this course. So I need it really deserved this international release that we are trying to develop between both institutions.
Thank you, Elena. So somebody was asking us if we had seen that this increase in the number of publications or the interest in science had been accompanied by the increase in their quality. And from what I'm listening to you, absolutely not. And that is one of the main objectives of this course, from what I understand.
Yeah, exactly.
And also, I mean, things are not linear. There is a huge increase in technology, and technology provides a better framework to do better science. For example, the way we analyze microbiology today is completely different to the way we analyzed it 15 years ago. So the technology is driving better scientific information. But unless you understand the technology, the results that we get today are completely non-understandable if we were trained in how the technology was 15 years ago.
Okay, so thank you very much. I think we don't have any more questions, just that you can find any further information that you may eventually need in the email that you have in the chat. And thank you very much for being with us today. Thank you especially to you, Mariano and Elena, for co-directing this course. So important, both for the University Complutense of Madrid and for CEPA, but for the whole dental community. And I hope we find the chance to meet again soon. Thank you very much for your attention.
Thank you. Thank you very much.
Thank you. Bye-bye. This is a 40 ACTAs postgraduate course with a blended learning. That means that we have 2 online modules and 2 on-site modules. So we will start in January 2027 with an on-site module in Madrid. We learn all the basic tools in order to allow you to learn the specific skills in order to perform adequate research protocols. Then we will move to the advanced tools with an online methodology for going later to the specific courses on periodontology, implant dentistry, and oral tissue regeneration. We will end with 1 week again here in Madrid in June 2027, and we will have a final evaluation and a defense of the research protocols that had been worked by each of your students.
I couldn't recommend more this course to anyone that really has that curiosity.
Not only for those that are in the beginning of their career, but it's for all experienced dentists as well that are willing to investigate at any time of their life.
I met a lot of young dentists and it was very fun and useful.
And more than that, you will be in Madrid, so you will have the opportunity to enjoy this fashion city. You cannot miss it. I will be waiting for you here.